is andropause? Andropause is the gradual decline of testosterone level in men. Testosterone may drop by about 1% each year after the age of 30 to 40. Some men experience clear changes in energy, mood, and physical performance. Managing andropause involves addressing both the hormonal changes and lifestyle factors that may be contributing to symptoms. Andropause isn't just getting older, it's a hormonal transition that can be assessed and managed to help men maintain quality of life. What is andropause? Andropause is the gradual decline of testosterone level in men. Testosterone may drop by about 1% each year after the age of 30 to 40. Some men experience clear changes in energy, mood, and physical performance. Managing andropause involves addressing both the hormonal changes and lifestyle factors that may be contributing to symptoms. Andropause isn't just getting older, it's a hormonal transition that can be assessed and managed to help men maintain quality of life. What is andropause? Andropause is the gradual decline of testosterone level in men. Testosterone may drop by about 1% each year after the age of 30 to 40. Some men experience clear changes in energy, mood, and physical performance. Managing andropause involves addressing both the hormonal changes and lifestyle factors that may be contributing to symptoms. Andropause isn't just getting older, it's a hormonal transition that can be assessed and managed to help men maintain quality of life. Hi everyone! Welcome to the Anna Hu channel, live sessions. I'm Dr. Anna Hu, founder and medical director of Anna Hu Clinic, an award-winning wellness and medical aesthetic clinic based in Kuala Lumpur. So thanks for joining me today. If you have been feeling low on energy, less motivated, or just not yourself lately, it might not be just getting older or tired. Today, we are talking about andropause, sometimes called the male menopause, and what it really means for you, your energy, mood, and overall health. I'll also share practical tips on how you can reclaim your energy and feel like yourself again. Before we dive deeper into the topic, let's watch a short video to better understand what andropause is. What is andropause? Andropause is the gradual decline of testosterone level in men, usually starting in their late 40s to 60s, although the process can be much earlier. Testosterone is a key hormone that supports muscle mass, bone strength, mood, energy, and sexual health. Unlike menopause in women, which happen relatively quickly, andropause is a slow, progressive change. Testosterone may drop by about 1% each year after the age of 30 to 40. Some men barely notice it, while others experience clear changes in energy, mood, and physical performance. This isn't just getting older, it's a hormonal transitions that can be assessed and managed to help men maintain quality of life. Welcome back to the Anna Hu channel. Many people ask me, why should I know about andropause? And why does it matter? Understanding andropause has really opened my eyes to what the men in my life might be going through. So as a wife, daughter, and daughter-in-law, it's been important for me to learn about how aging affects my husband, father, and father-in-law. I've noticed changes in their moods or energy levels, and knowing that this might be tied to andropause helped me approach them with more compassion. So for instance, if my husband seems more tired or irritable, instead of taking it personally, like they are judging me or condemning me, and I can remind myself that he might be going through some hormonal shift. And this understanding allowed me to support him better and communicate openly about how he's feeling. So overall, being aware of andropause has strengthened our relationships and brought us closer together as we navigate these changes as a family. So for you, you should know about andropause because it is a natural phase in a man's life that can significantly affect physical health, emotional well-being, and overall quality of life. So often referred to as male menopause, andropause is caused by a gradual decline in testosterone level, which can lead to symptoms such as fatigue, mood changes, reduced muscle mass, weight gains, and a lower sex drive. Understanding andropause is important because these changes, if left unaddressed, can impact relationship, work performance, and self-confidence. By being aware of its signs and effects, men can take proactive steps such as making lifestyle changes, seeking medical advice, and considering appropriate treatments to manage symptoms and maintain a healthy, fulfilling life as they age. Awareness also helps reduce the stigma around men's hormonal health, encouraging more open conversations and timely support. So what exactly is andropause? It is the gradual decline of testosterone in men, usually starting between the late 40s and 60s. Testosterone plays a vital role in supporting muscle mass, bone strength, mood, energy, and sexual health. Unlike menopause, andropause is a slow, progressive change, with testosterone level dropping about 1% per year after the age of 30 to 40. While some men barely notice any difference, others may experience significant shift in energy, mood, or physical performance. Have you felt changes like this yourself? Comment yes if you can relate. Waiting for your comment then. Before we dive deeper, I have an exciting offer. During this live session, you can win a free in-body body composition test and a one-on-one consultations with our nutritionist. This will help you understand your body composition, metabolic health, and nutritional needs, so you can take steps to feel healthier and more energized. To participate, just type your questions about andropause or men's health in the comment during this live session. 5 winners will be announced tomorrow on the Anna Hu channel Facebook page, so follow us and stay tuned. Let's kickstart our Q&A sessions today by jumping into one of the most common questions we get when talking to patients about andropause. Do all men experience andropause at the same age? The answer is no. Testosterone decline is highly individual. So some men start noticing changes like low energy, reduced motivations, irritability, or decreased libido in their early 40s. Others might not experience major changes until their 50s or 60s. Genetics, lifestyles, sleep quality, stress level, and overall health all play a role in when and how symptoms appear. Next question, is andropause just like menopause? The answer is not exactly. Menopause happens relatively quickly and marks a clear hormonal shift in women. Andropause, on the other hand, is gradual, with testosterone slowly declined over many years. So some men hardly notice any changes, while others experience significant shift in energy, mood, muscle mass, and body composition. Next questions. Can andropause lead to serious health problem? What's your answer? The answer is yes. Andropause can lead to serious health issue if left unaddressed. The gradual decline in testosterone not only affects mood, energy level, and sexual health, but can also contribute to long-term problems such as osteoporosis, cardiovascular disease, type 2 diabetes, and metabolic syndrome. Low testosterone can also worsen mental health, increase the risk of depression, anxiety, and cognitive decline. While not every man will experience severe complications, understanding the potential risk will allow for early detection, lifestyle adjustment, and appropriate medical intervention, helping to maintain both physical and emotional well-being as men age. Have you noticed these changes in yourself or someone you know? Comment yes if this sounds familiar. Keep your questions coming. 5 lucky winners will receive the free in-body test and nutritionist consultation. Alright, it's time to discuss the symptoms of andropause. These symptoms can be very mild and easily overlooked, with many people thinking they are just common signs of aging. Let's watch another video to help you better understand the causes and symptoms of andropause. Andropause is the gradual decline of testosterone level in men. Testosterone is a key hormone that supports muscle mass, bone strength, mood, energy, and sexual health. Testosterone may drop by about 1% each year after the age of 30 to 40. Some men experience clear changes in energy, mood, and physical performance. What are the causes of andropause? The primary cause of andropause is natural aging, which gradually reduces testosterone production over time. However, several factors can speed up or worsen this decline, including chronic stress. High cortisol level will interfere with testosterone production. Poor sleep. Most testosterone is produced during deep, restful sleep. Excess alcohol disrupt hormone balance and affect liver function. Obesity, especially belly fat, which can convert testosterone into estrogen. Medical conditions such as diabetes, metabolic syndrome, thyroid disorder, and sleep apnea. Andropause isn't just getting older, it's a hormonal transition that can be assessed and managed to help men maintain quality of life. Welcome back to the Anna Hu channel. Let's recap some important points from the video. So what are the causes of andropause? Causes of andropause are like natural aging, which is the main reason testosterone decline over time. After age 30 to 40, levels slowly decrease, and by the late 40s to 60s, many men start noticing the effects. It could be because of chronic stress, because long-term stress raises cortisol, which can interfere with testosterone production. So feeling constantly on the edge or overwhelmed can speed up hormonal decline. Poor sleep is also one of the important causes. Testosterone is mostly produced during deep restorative sleep. Poor quality or irregular sleep can worsen symptoms. Excess alcohol. Heavy drinking can disrupt hormonal balance, damage the liver, and reduce testosterone production. obesity, especially belly fat, which contain enzymes that convert testosterone into estrogen, eventually will lowering the testosterone further. Medical conditions, diabetes, metabolic syndrome, thyroid disorder, and sleep apnea can accelerate testosterone decline and worsen symptoms. And did you know that conditions like obesity, lack of sleep, and chronic stress can lead to early andropause? Yes, conditions like obesity, lack of sleep, and chronic stress can contribute to early onset of or worsening of andropause symptoms. These are common symptoms that can interfere with your daily life and stop you from performing at your best. Low energy and fatigue, feeling tired even after rest. Reduced muscle mass and increased belly fat. Low libido or reduced interest in intimacy. Erectile difficulties. Mood changes. Irritability. Low mood. Anxiety. Poor focus. Sleep problem. Difficulty falling asleep, staying asleep, or feeling rested. Hot flushes or night sweats. Less common but possible. If any of these symptoms sounds familiar to you, drop a yes in the comment. Sometimes we think it's just getting older, but these changes may be linked to testosterone levels. Alright, let's answer another questions from the audience. Keep your questions coming. We have an exciting offer for you. During these live sessions, you stand a chance to win a free in-body composition test and a one-on-one consultations with our nutritionist. This will help you understand your body composition, metabolic health, and nutritional needs better, so you can take steps towards feeling healthier and more energized. To participate, simply type your questions about andropause or men's health in the comment during these live sessions. We'll announce 5 lucky winners tomorrow on the Anna Hu channel Facebook page, so make sure to follow us and stay tuned. Is andropause caused by aging? Aging is one of the main factors, but it's not the only cause. Stress, poor sleep, excessive alcohol consumption, obesity, and certain medical conditions can all accelerate the onset and severity of andropause symptoms. Does andropause only affect sexual health? The answer is no, definitely not. Testosterone affects much more than just sex. Low levels can lead to constant fatigue, mood changes such as irritability, anxiety, and poor concentrations. Physical changes like reduced muscle mass and increased belly fat, and sleep problems such as difficult falling asleep or staying asleep. Okay, let's discuss in more detail about this topic that affects many of us as we age, right, for ourselves or our family member, the male hormone, testosterone. So don't worry, I'm going to keep it light, easy to understand when you ask questions. So let's dive in. Before we proceed with the questions, I will go back to understanding of the hormonal changes. So as we age, our body go through some natural changes. So this is totally natural, especially when it comes to hormones. So you might have heard about this, but allow me to break it down in slower steps so we can get to know it step by step. In women, this change is quite drastic. So as they approach menopause, reproductive hormones take a significant reduction in a very short period of time. For men, however, it's a bit different. The drop in hormones, specifically testosterone, is way much slower and happens gradually over the years until sometimes we don't even notice it. Now, I want to touch on a terms that you may have heard before, male menopause. These terms can be misleading because men's hormonal changes don't occur in the same way as what happened in women's. Men don't experience a sudden end to their reproductive hormones. So instead, their testosterone level declines slowly, often starting around age 40. So this gradual decrease in testosterone is known as late onset hypogonadism in the medical terms, or simply age-related low testosterone. So it's important for us to understand that not every man will experience noticeable symptoms. In fact, many might have lower testosterone level without even realizing it if they do not focus or didn't look for the difference. So did you know that about 10 to 25% of older men might have testosterone level considered low? But here's the catch. Many of these men don't show or didn't realize they have any symptoms at all. A simple blood test can help check testosterone levels, but not everyone gets the testosterone level tested. Now, if you or someone you know is concerned, here are some common signs that might suggest low testosterone, as what we have discussed before. Just another summary for you to recap a bit. A decrease in sexual desire or libido or activity. Struggle with erectile issues. Tenderness or swelling in the breast. Infertility. Experiencing hot flashes, like the women part. Loss of height or increased fracture. Other signs might be feeling more fatigue, having less motivations, or even experiencing mood swing. So I see some of the questions that being asked here indicating that is agitations, is grumpiness a sign of andropause? The answer is yes. But how severe it is, you will need to assess an individual's emotional conditions and at the same time the physical conditions as well. So from emotional perspective, depressions or difficulty focusing can also set in as when the testosterone level is getting lower and lower. Remember, many conditions can cause these symptoms too. For example, of what we have shared during our previous Facebook Live, like inflammations and nutritional deficiency, overstress in the working environment, or overstress at home, no peace of mind. It could be signs of similarity with low testosterone, not just low testosterone alone. So our lifestyle choices, like being overweight or leading a sedentary lifestyle, can also play a significant role whether andropause will set in early or late. So now, let's answer some of the questions that are being asked by the audience. So question number 1 from Maureen, is it same like androgen? So what's the difference between androgen and testosterone? So androgen, this term itself, indicating a group of hormones that play a role in male traits and reproductive activity. Testosterone is the most well-known and predominant androgen, but it is not the only one. So from the definitions perspective, androgen is a broader category that includes a variety of hormones responsible for the development and maintenance of male features. Other androgens which include are DHEA, DHT, and those hormones can be tested as well besides just testing the testosterone alone. Testosterone per se, this is a specific type of androgen and the primary male sex hormone that is important for the development of male reproductive tissues, as well as it will promote secondary sexual characteristics like increased muscle and bone mass. At the same time, it will also give an impact on an individual libido or sexual desire as well. So when we're talking about androgen and testosterone, the source where the organ that producing the androgen and testosterone, it can be varies as well. So for androgen, they can be produced in the adrenal gland, testicle, and ovary in female. Whereas for testosterone, the primary productions area is in the testicle in men, with smaller amount produced in the adrenal gland. Whereas in women, it produced in the ovaries and adrenal gland in much lower quantity. So besides where it produced, the function of androgen and testosterone, there is a difference as well. For androgen, this hormone contribute to a variety of functions in both men, male and female, including influencing sexual drive, bone density, fat distributions, and muscle strength. Whereas for testosterone, it more specifically contributes to the development of male reproductive organs. Mainly, the libido influences the fat in the body, impact on an individual mood, and support muscles and bone health. So in summary, while testosterone is an androgen, not all androgens are testosterone. They encompasses a variety of hormones that contributes to male development and health. So let's look at the second question. Is agitation a sign of menopause? Yes, agitations can be one of the signs associated with andropause, which is often referred to as male menopause. So andropause typically occur in elder men and can involve a variety of symptoms due to hormonal changes, particularly a decline in the testosterone level. So the common symptoms beside agitations are mood changes, irritability, fatigue, depressions, reduced libido, and changes in sleep patterns. So just in case if you or someone you know or close to you is experiencing this symptom, it may be beneficial to consult a healthcare professionals for evaluations and potential treatment options. Let's go to the third question. At what age starts andropause? So as what we have discussed before, andropause typically begins in men as they reach their late 40s to early 50s. Although the exact age can be very significantly from person to person, some men may start to experience symptoms earlier in their 30s or 40s, while others may not notice changes until their 60s or later. So one of the things that I would like to discuss here in regard of this is sometimes whether an individual able to feel or experience a symptom, it's also depending on whether they are looking forward for optimum performance or not. If an individual set a very high benchmark on their energy level, on their mental clarity, on their skeletal muscle mass level, and on their percentage of body fat, generally they might notice there are early onset of menopause because they care about those figures and they care about those symptoms and they would like to perform it earlier. So for most of the time, individuals that experiencing andropause that come later in life are those people that who are happy-go-lucky and then they just flow with time, and then with that lower anticipations and lower expectations from the body, generally they will experience, maybe they might feel that their andropause come later in life. So again, if there are concerns about symptoms or hormonal changes, it's advisable to consult your healthcare professional or practitioners for assessment and guidance. Then let's go to another question. Are men more grumpy? The answer is, as what we have shared just now, is an emotional exhibitions of situations where the male, the lower in the testosterone level. So I have a comment there. Yes, I can feel the changes in my husband mode. So if there is a concern, maybe you can get the blood testosterone tested as well. Can regular exercise and diet really delay the effect of andropause? The answer is yes. Regular exercise and if an individual taking care of their diet properly, it will delay the onset of andropause. While andropause is a natural part of aging, certain lifestyle factors may help delay its onset or mitigate its symptoms. So here are some ways that might help. Number one, regular exercise, as what being suggested by one of the audience. So engaging in regular physical activity, including strength training and cardiovascular exercises, can help maintain testosterone level and improve overall well-being. That one is something very clear. So secondly, can also take care the diet. Healthy diet, a balanced diet rich in whole food, including fruits, vegetables, lean protein, and healthy fat can support hormonal health. So some studies suggest that certain nutrients like zinc and vitamin D may play a role in testosterone production as well. So healthy diet also means that low in sugar and low in carbohydrate to prevent obesity. So weight management, maintaining a healthy weight can help regulate hormone level. Obesity is often associated with lower testosterone level. Stress management is important. So chronic stress can lead to hormonal imbalance. Practicing stress reduction techniques such as mindfulness, meditations, or yoga can be beneficial. Adequate sleep. Quality sleep is crucial for hormone balance. Poor sleep pattern can negatively affect testosterone level. To get enough rest is extremely important. Not to forget as well some lifestyle habit like alcohol and smoking. Avoiding alcohol and smoking can help improve overall health and may positively affect the hormone level. So besides that, it's also important for us to have regular health checkup, monitoring and managing health conditions like diabetes, hypertension, and high cholesterol can support overall hormonal balance. Option-wise, sometimes you can take additional supplements. Some supplements such as zinc, magnesium, D-aspartic acid, vitamin D may support testosterone level, but it's essential to consult with a healthcare practitioner before starting any new supplement regime. While this strategy may help, it's also important to consult a healthcare practitioner for personalized advice and monitoring related to hormonal health. Let's see. So with that, maybe let's proceed with the second part of the video. Andropause is the gradual decline of testosterone level in men. Testosterone is a key hormone that supports muscle mass, bone strength, mood, energy, and sexual health. Testosterone may drop by about 1% each year after the age of 30 to 40. Common symptoms of andropause may present in many ways, with symptoms often developing gradually. Common signs include low energy and fatigue, feeling tired even after adequate rest, reduced muscle mass and increased belly fat where there is noticeable changes in body shape, low libido where patients might complain decreased interest in sexual activity, erectile difficulties where patients may have trouble achieving or maintaining an erection, mood changes where patients may appear to be irritable, low mood, or difficulty concentrating. Sleep problems, patients usually will complain trouble falling asleep or staying asleep. Managing andropause involves addressing both the hormonal changes and lifestyle factors that may be contributing to symptoms. Common strategies include testosterone replacement therapy, where medically supervised hormone therapy to restore testosterone to healthy levels. Lifestyle changes, where regular exercise, especially strength training, will be able to maintain muscle mass and boost hormone balance. Healthy nutrition, a balanced diet rich in lean protein, healthy fats, and whole food while reducing processed sugar and refined carbs. Quality sleep, aiming for 7 to 8 hours of restful sleep each night to support natural hormone production. Stress management, techniques such as meditation, deep breathing, or engaging hobbies to lower cortisol level will help the symptoms. Limiting alcohol, reducing intake to maintain hormonal health and liver function. Treating underlying conditions, managing issues like diabetes, obesity, or thyroid disorder that can worsen the symptoms. Supplements such as vitamin D3, zinc, or omega-3 to support overall wellness. Andropause isn't just getting older, it's a hormonal transition that can be assessed and managed to help men maintain quality of life. Welcome back to Anna Hu channel. At Anna Hu Clinic, we believe in addressing andropause with a truly holistic approach. Our goal is not just to treat the symptoms, but to support every aspect of your well-being, from hormonal balance and physical health to emotional wellness and lifestyle habit, so you can achieve optimal health and live life to the fullest. Now let's take a closer look at the treatment options for andropause and how you can effectively manage this condition. What can you do? Testosterone replacement therapy. Medically supervised testosterone therapy can be used to restore healthy testosterone level. Besides that, lifestyle changes like regular exercise, especially strength training, is important. Taking in healthy nutrition, balanced diet with lean protein, healthy fat, whole food, and reduced processed sugar will help to delay andropause. Quality sleep, 7 to 8 hours nightly is important. Stress management, meditations, deep breathing exercise, hobbies to lower cortisol level will be very helpful. Limit alcohol, maintain hormone balance and liver health, it's important too. Treat underlying conditions like managing diabetes, obesity, thyroid disorder, and some other medical diseases, it's important. It's Q&A time again. Let's address a few questions from the audience. Is testosterone therapy dangerous for all men? The answer is not necessarily. When prescribed and closely monitored by a qualified doctor, testosterone replacement therapy can be both safe and effective. Regular checkup is important to ensure proper dosing and helps prevent side effects. In fact, testosterone replacement therapy can restore energy, improve mood, increase muscle mass, and boost libido for men with low testosterone. Next question. Is it true that you can't prevent or slow down andropause? That's a myth. While aging is inevitable, healthy lifestyle choices can support testosterone level and overall wellness. Regular exercise, especially strength training, help maintain muscle mass and hormonal balance. Eating a balanced diet, prioritizing quality sleep, managing stress, and limiting alcohol intake all play important roles in slowing down the effect of andropause. Okay, let's go back to the question and answering session. Okay. Need to do blood test to confirm andropause or to confirm the male menopause. So generally, the andropause, we start to diagnose the moment when the patient presented to us with signs and some of the complaint, like what we have shared before. And there are several things that basically we can work on, and there are several tests that we can perform to confirm when a patient presented to us with the signs and symptoms like what we have shared just now, some mood changes or some sexual performance challenges. What we can do is we can help them to improve the conditions by suggesting some of the lifestyle adjustment. And if lifestyle adjustment cannot help them to improve on those signs and symptoms, we can proceed to do some blood tests. So some patients, they would like to get to know their conditions better. Then what we will do is we will proceed with the blood test straight away. There are few blood tests that we can perform. So one of the blood tests that we usually perform for patients, and which is the commonest blood investigations that we will share with patients, are total testosterone level and free testosterone level. So for total testosterone level and free testosterone level, we can perform the test or we can draw the patient's blood anytime. And beside total testosterone and free testosterone, we can also perform follicular stimulating hormone, FSH, and we can perform luteinizing hormone. So sometimes when the level of FSH and LH exceeding certain level, it will also indicating that the circulating testosterone level is insufficient. So for those who are concerned and would like to have more clarity, I would propose you consult with your healthcare practitioner so that you can get your sign and symptom to be assessed properly, and at the same time to get the blood test done properly as well. Then the next questions that we have here is, can we take supplements to improve the testosterone level? Yes, there are several supplements that are commonly believed to help improve testosterone level, although the effectiveness can vary from person to person depending on what is the main root cause which contributing to the early or to the andropause itself. Some of the more common or popular options include vitamin D. Many studies suggest that adequate vitamin D levels may be linked to testosterone production. So supplementations can be beneficial, especially in individuals who are deficient. Besides vitamin D, zinc is also one of an important supplement. So zinc, this mineral play a crucial role in testosterone production. Supplementing with zinc may help improve the testosterone level in those who are deficient. Besides zinc, magnesium will be able to assist as well. Like zinc, magnesium is important for various body functions, including testosterone production. So supplementing can be helpful if there is a deficiency. D-aspartic acid. So some studies suggest that this amino acid may help increase the testosterone level in some men, not everyone, particularly those who are trying to enhance their athletic performance. So some herbs like fenugreek, this herbal supplement may help increase testosterone level and improve the libido, according to some research. Terrestris. Though the evidence is mixed, some people believe that this plant extract may help raise testosterone level, particularly in individuals with low level. Not to forget as well, ashwagandha. This adaptogen or adaptogenic herbs has been shown in some studies to increase the testosterone level and improve overall vitality and energy, especially for those adrenal fatigue individuals. Not to forget a very common nutrition, which is the omega-3 fatty acid. While this omega-3 fatty acid, it's not directly linked to testosterone production, these can support overall health, which may indirectly benefit hormone level. However, before starting any supplement regime, it's important for you to get to know your body conditions properly, and by consulting a healthcare provider or practitioner may assist you in this. So while we are talking about supplementations to improve on testosterone level, lifestyle factors such as diet, exercise, sleep, and stress management can also significantly impact testosterone level. So, what I personally will propose is it's important for us to look at the whole journey of an individual. So if an individual's testosterone level is low, it's actually important. You can do a self-check. Are you encounter any inflammations? So you might go back to our previous Facebook Live, which sometimes might not be in the Facebook page itself, but you can go to our Anna Hu channel in the YouTube segment where you can go through what are the signs and symptoms of inflammations. So before we conclude that, whatever irritability or mood changes or anger or anxiety which indicating indicating andropause or low in testosterone, is also extremely important for us to understand that whether the inflammations level is it high or not. If the inflammations level is high, to get rid of all those inflammations agent, assisting the body in recovery. Besides that, check on your nutritional status. If your nutrition status day to day you are not eating well, you're skipping meal, your stress level is high, you have indigestions or you have bloatedness, nutritional deficiency, if in severe conditions, it might eventually impact on the testosterone hormone productions as well. So look at inflammations, look at your nutrition status, then only we look at the hormonal level. It's not so advisable just by restorations of the hormone without taking care of inflammations and nutritional status. Okay, then what we can do is we can go to the next question. Can we take what treatments to seek? So let's go to what treatment to seek. For andropause, okay, as what we have shared just now, andropause is age-related. So what are the treatments available? Like what we have shared just now. If an individual have sign and symptom of testosterone deficiency, right from either physical shape and size, for example, skeletal muscle mass reduction, for example, reduce sexual desire, reductions in libido, for example, low in energy level, frequent brain fogginess, anxiety, irritability. When all those things sets in, don't sit quietly. You may discuss with people who are close to you, and then the best thing is to seek for a proper assessment. So go to your healthcare practitioner. So in the healthcare practitioner office, what they will do is they will kickstart with a proper consultations. Like for example, if you come to an Ahu clinic, what we will do for you is we will do a proper consultations for you, and during the consultations we will identify what are the signs and symptoms that bothering you, what are the things that trigger you. Then from there we will have a proper history taking in regards of your sleeping hour, in regards of your diet intake, in regards of how much water intake how much water are you drinking every day, and then what type of food that you are eating, what is your stress level, and things like that. So if you're coming for the andropause purposes, so we do have a list of questionnaire which we will go through all the potential signs and symptoms related to not only testosterone deficiency, related to thyroid hormone deficiency, related to progesterone deficiency, estrogen deficiency, cortisol deficiency, and DHEA deficiency. Because we would like to know whether is it pure andropause or overall all the hormone also being impacted and each and every hormone is low. The treatment options and the treatment modality are totally different. Okay, so then next, When we get to know the question from the questionnaire, then we will decide which are the blood tests that we are going to do. So andropause refer to age-related changes in testosterone level in men, similar to menopause in women. So maybe I just go through my explanation just now again. While there is no single test to definitely diagnose an andropause, so blood test measuring the testosterone level can help determine if a man is experiencing low testosterone, which may be associated with symptoms of menopause. So in addition to testosterone level, most doctors may also evaluate other factors, such as like what I have shared just now, luteinizing hormone, LH, and follicular stimulating hormone, FSH. And most of the time, we will also perform hormone tests for the other hormone like thyroid hormone, like cortisol, DHEA, estrogen, and progesterone. So if you suspect you are experiencing the symptom of andropause, you can consult a doctor and get a proper consultations assessment. Then eventually your doctor will come out a treatment plan for you. So treatment plan for andropause, again, like what I have shared, besides we go straight to hormone replacement, it is important to understand what is the root cause of testosterone deficiency. Whether is it pure testosterone deficiency or a whole list of hormone which is deficient. Then from the whole questionnaire, we will be able to understand your body better. And then from there, we will be able to look at inflammation, nutrition, then only hormone. Most of the time, if it's an early andropause, the moment when we address the inflammation part, when we restore back the nutrition, the hormone organ eventually will be functionable again. So when it's functionable again, the organ will be able to produce back the hormone as what it's supposed to be. However, all this process, it will take time, okay? It doesn't happen within 1 or 2 treatments, and usually we will follow up the patients from time to time and then to make sure they already regain or relearn how to live a healthy life again. All right? So let's continue our discussions. Maybe I'll go through some of the important points during the second video. So experts generally, they recommend only testing testosterone level in older men if they are experiencing symptoms. So if the test show low level, it's a good idea to confirm the result with a second test before jumping to action. So before confirming on the second test, lifestyle changes like getting enough sleep, staying active, exercise, and eat right can sometimes make a big difference for those patients. So we will get the patients to adopt a new healthy lifestyle to help their body to increase the testosterone productions again. And if the testosterone production is still low, then only we will discuss with the patients whether they would like to restore back the testosterone or not. Okay, and then when we are talking about low testosterone, sometimes we will check the pituitary gland as well. So pituitary gland is what I've discussed just now, LH and follicular stimulating hormone. A small but mighty gland, the pituitary gland is a small but mighty gland at the base of our brain that help regulate the hormone production. So it's all about understanding what's going on in the patient's body. And when we are talking about testosterone therapy, advice from doctor will be varies according to different group of doctor. So some organizations recommend it for older men experiencing the low testosterone symptom to initiate the testosterone treatment. And some doctor would believe that it's natural to have low testosterone, so they will say that testosterone level is not indicated. However, when we go through these questions with patients, whether you need or you do not need a testosterone treatment, it's basically go back to what's the patient desire of their body. What do you want? So for those patients that not restoring the testosterone, as what we are observing for example, our parents or our grandparents, you might notice that as time passes by, their functionality is getting lower and lower. And this reduction in functionality means their confidence level will reduce, their anxiety level will increase, and the way they make decisions might not be from the younger versions of themselves that can have clear mind, have great confidence, have firm decision making skill. Now they might be experiencing that the decision making is to avoid challenges, to avoid the fear that they have in mind, and to avoid conflict with people, rather than to get the good results that they deserve. However, decision making is purely depending on individual. So personally, I would think that when I discuss this point with most of my patients, so those from corporate field where they are still actively working, they would like to regain back their brain function. They would like to regain back their confidence. They would like to regain back the ability to communicate with other people without feeling of anxiousness, insecurity, and agitations at all time. So insecurity is one of the biggest challenge for I would say that for men 55 and above, the moment when they feel that they are being challenged because of insecurity, then they become very defensive. They're no longer able to view the situation as clear as what it's supposed to be. And this will affect relationship with people. Okay? Then when we are looking at, so I will not be able to answer all the questions. So maybe I will discuss a little bit about the risk and decisions making. So if an individual decides to explore on the testosterone therapy, your healthcare provider or the professional will discuss the different way to take it and the potential benefit versus the risk. So for some, therapy can provide relief from bothersome symptoms like the emotional disturbance, energy level, the mental clarity, but it is also very crucial for us to be aware of the potential risk. Like according to literature, certain increase in it might cause increase in certain chances of cancer or increase in the possibility of getting the blood clot. So it's not a treatment that you can initiate it yourself, but you need your healthcare practitioner to do a proper assessment for you and then to make sure you are ready to kickstart the treatment. So you also want to think about your future family plan. If having children is in your near future, hormone therapy might not be the best option for those who have early andropause as well. So as a conclusion, if you suspect you might have low testosterone or are experiencing any related symptoms, don't keep it to yourself. Talk to your healthcare practitioner about your concern. They can guide you through the testing and help you figure out the best step forward. So thank you everyone for spending your time with me today. Remember, understanding our body can lead to stronger health and wellness, and it's always best to face these changes with love and care. Self-love, it's important. So if you have any questions or thoughts, and for those questions that I'm not able to answer, I will try to answer it next round. Feel free to drop them in the comment or to reach out to me. Take care, everyone. And remember, you are not alone in this journey. We will be able to assist you throughout if you need us. Bye.